Okay, good morning, all of you. In this class, we will start with the understanding of the various internal processes of the body and how the internal environment of the body is maintained at a constant rate and at a constant value. In other words, today we shall try to understand the definition of homeostasis and how this homeostasis is maintained, or the internal environment of the body is maintained constantly in different situations where some variables try to change the normal parameters. So today, first of all, let us define homeostasis. Let us see what do we mean by ECF, what do we mean by ICF, what is the definition of the ECF, ICF, what are the constituents of ECF, ICF, and lastly we shall see the mechanisms which are involved in maintaining the internal environment at a constant rate. So first of all, how do you define physiology? If you remember in the earlier class, I had said that physiology is nothing but a science that is concerned with the functioning of the living organisms and the physical and the chemical processes involved. So in other words, first of all, we have to understand how does the body functions. Let's say, for example, the respiratory system. How is that the body is maintaining a constant respiratory rate at 12 per minute, or how is it that the body maintains a constant heart rate of around 70 to 80 beats per minute? How is that the blood pressure in the body is maintained in the normal range of, let's say, 120 to 130 systolic and 80 to 90 diastolic? This is the understanding of these functioning of the body. In addition to this, we shall also see in the later on subsequent classes that how it is maintained constant. For example, there are certain events or certain times when the blood pressure goes up suddenly from a normal of 120 systolic to around 130, 140 systolic. Now, what does the body do, or how does the body brings this back to normal? That is the second step in understanding the physiological processes. What are the mechanisms which are involved which try to bring that high blood pressure back to normal? Or in the other way, how does it brings it back to normal when the blood pressure falls below or is too low down? Say, for example, the systolic blood pressure is around 120. If it goes to around 100 or 90, what are the mechanisms which the body will initiate so that the blood pressure comes back to normal to around 100, 110 systolic? Apart from that, we will also try to understand later on in the subsequent sections of physiology that if this blood pressure doesn't comes back to normal, what are the consequences or what are the damaging effects a blood pressure will have this will have on the body. Say, for example, if the blood pressure remains constant to around 130, 140, 150 systolic and does not comes down to normal, what is the damaging effect seen on the heart itself and on the other organs? Similarly, on the way down, if the blood pressure is not brought back to normal from, say, example 90 or 80 systolic to normal 120, what are the effects which are seen or the damaging effects seen on the body? So this is basically, first you understand the normal functioning of the body, then you go how is it maintained normally, and then what are the effects seen if the normal homeostasis does not comes back to normal. Next, then this, when it is, as long as the functioning is normal, it is called as physiology. If there is a disordered function, then we call it as disease, and that is pathophysiology. This pathophysiology then becomes the basis for clinical medicine. So this is how, in a stepwise fashion, you will learn. So first you will learn the normal functioning of the body, then you will see how the normal functioning is disturbed, and if it is disturbed for a long period of time, what are the changes that are seen, and these changes which you see in the disturbed conditions of the body or in the altered conditions of the normal parameters, that is called as pathology, or it is also pathophysiology. And if this pathophysiology is sustained for over a period of time, then that becomes a disease and it is the basis for your clinical medicines in the subsequent years. Now let us see homeostasis. What does homeostasis means? Stasis means constant, homeo means internal environment, body. A constant environment or a constant internal environment being maintained is called as homeostasis. So homeostasis is nothing but maintaining constant conditions inside the body. This term homeostasis was coined by Claude Bernard, and he gave the word a constant internal environment. Now let us see, to start with, try to understand how this constant internal environment is maintained. For example, we know that the whole body is composed of millions of cells. These cells unite to form tissues. A group of tissues form one particular function, it is known as organ, and all these organs, 2 3 organs together, unite to form a constant common function, and that becomes an organ system. Now, to understand, basically, let us see the cellular level. We know that cell is the basic structural and the functional unit of life. All the cells within the body perform a constant function. The rate at which they are metabolizing, the rate at which they are forming the various products, the way which they are eliminating the end products from the body remains constant in all the cells. So, cell constitutes the basic structural and the functional unit of life. Now, in the body, if you see, roughly there are around 100 trillion cells. Out of these 100 trillion cells, 25 trillion cells are blood cells, that is the red blood cells, and the remaining are the other tissue cells. Remaining 75 trillion cells are the other cells. Now let us pick up the point from this cells itself. The 25 trillion cells are the cells nothing but the red blood cells, also called as RBC, and the function of this RBC is to carry oxygen from the lungs and to provide it to the other 75 trillion cells. These 75 trillion cells, after receiving this oxygen, utilizes this oxygen to break down the nutrients, carbohydrates, fats and proteins, and generate energy. So the ultimate aim of all these cells is to generate energy so that the bodily functions can be maintained. Whether these cells may be in different tissues, or may be a part of different organs, or may be part of organ system. So basically, the 25 trillion cells, that is the RBCs, are carrying oxygen, and they carry oxygen to the remaining 75 trillion cells, and these 75 trillion cells utilize this oxygen to generate energy by utilizing the carbohydrates, fats and proteins. I think till here it is clear. Now let us see how a constant or a homeostasis or an internal environment is maintained, and what happens if there is a disturbance in this cellular function. Now let us imagine the 75 trillion cells, the 25 trillion cells are carrying oxygen and supplying to the remaining 75 trillion cells. At some point of time, for some reason, if these count of 25 trillion cells is reduced, say for example there is internal bleeding, or there is some blood loss, or there is some nutritional deficiency where the body is not able to have 25 trillion cells. So how will the internal environment be disturbed? Now the basic function of RBC is to carry oxygen. If the count of the cells falls from 25 trillion cells to say around 20 trillion cells, the amount of oxygen which is carried from the lungs to the tissues get reduced. So in other words, now only 25 out of 25, only 20 trillion cells are carrying this oxygen to the 75 trillion cells. That means the oxygen supplied to the cells is reduced. Now when the oxygen supplied to the cells is reduced, what is happening? The utilization of the nutrients and breakdown of these carbohydrates, proteins and fats is reduced, as a result of which there is less amount of energy which is being nutrients which are being generated in the body. So less energy is generated. When less energy is generated, there is a weakness of the system. All the cells begin to function at a less than normal level, and the person as a whole, or the organ as a whole, or a body as a whole, begins to feel tired and easily fatigued. So just see the difference. As long as the 25 trillion cells are carrying oxygen and supplying it to those 75 trillion cells, the functioning is maintained normally. But at any point of time, for any reason, this 25 trillion cell counts comes down to 25, the oxygen supply is reduced. So now what happens when the oxygen supply is reduced? The body detects that there is a less amount of oxygen going to this tissue, to the cells, and the body will try to generate more and more RBCs. So there will be increased production of RBCs or erythropoiesis, that is production of more number of RBCs by the bone marrow, so that the count comes back to 25 trillion cells, so that the oxygen carrying capacity is restored back to normal. And once this is restored back to normal, all the other cells are receiving adequate oxygen, and there is adequate breakdown of nutrients, so that energy is generated. So this is nothing but a beautiful example of maintaining a constant internal environment or a homeostasis. Now what can be the cause where the cellular count comes down? There can be multiple things. Now if you want to go into the pathophysiology, here it is, there is a decrease in the RBC count. A decrease in the RBC count is called as anemia. So when does this RBC count decrease? The RBC count can be decreased because there may be some internal bleeding, or there may be a blood loss, or there may be nutritional deficiency where you are not taking adequate amount of nutrients, say for example iron and proteins, so that the bone marrow is not getting enough nutrients to produce the RBCs, so the RBC count can come down to so that it can fall from 25 trillion cells to less than that. This is called as anemia. And how does the body respond to it? The body responds to it by producing more and more RBCs from the bone marrow. But because one of the cause can be a decreased nutritional deficiency, and which is called as anemia, you can correct it only by taking more amount of iron. Or the body will try to maintain a constant environment by trying to absorb more amount of iron from the food which you are taking in. Say for example, if out of the total body only 20% of iron is absorbed from the GIT in the normal conditions, during such conditions of anemia, the body will try to absorb more amount of iron from the GI tract. This is how the body tries to maintain a constant RBC count. Or there can be another example where you will find that the number of 25 trillion cells are normal, the 75 trillion cells are normal, but there is a less amount of oxygen entering into the RBCs itself. That can also disturb the internal environment, or also that can disturb the homeostasis. Say for example, if you are going at a high altitude, let us briefly discuss about the effect of less oxygen tension when you go at high altitudes. Normal, as long as you are in the normal environment, the oxygen saturation is somewhere around, atmospheric oxygen saturation is somewhere around 100%. When the oxygen saturation in the atmosphere is at 100%, your body or your lungs is taking in sufficient oxygen, transferring it into the RBCs. The RBCs are carrying it to the different cells. But say for example, if you go at a very high, say if you go on to the Himalayan heights or too high at a high altitude, the oxygen tension in the atmosphere, the partial pressure of the oxygen in the atmosphere gets reduced. When this gets reduced, naturally there will be less amount of oxygen entering into the lungs. But since the RBC count is normal, the RBCs are now receiving less amount of oxygen from the atmosphere, so there is less amount of oxygen which is going into the tissues, resulting in anemia. So this anemia is because of high altitude, less atmospheric oxygen or less PO2 in the atmosphere. So how does the body tries to correct the disturbed internal environment is, the body will try to get in more oxygen, and you will try to become breathless. I mean dyspnea. You will try to take more air in, which is called as dyspnea. So you will find it breathlessness happening. And exactly what is this breathlessness? The breathlessness is nothing but where the inspiratory effort is increased, the respiratory rate is increased, so that with each inspiration you take more amount of oxygen, which you call it as air hunger. So more oxygen enters, and if you breathe instead of 12 times, more number of times, more oxygen goes into the lungs. So more oxygen is passing on into the RBCs, and the tissues are trying to get more oxygen. The hypoxia is corrected, and oxygen supply is restored. So here you will find that there is a disturbance in the internal environment, not because of the RBC count is altered, but because the amount of oxygen entering into the cells is also reduced. So the body tries to restore this balance, or tries to maintain a constant internal environment where the amount of oxygen should be normal by causing increased breathing effort, which we call it as breathlessness. So this is one example where we try to explain, or the body tries to maintain a constant oxygen saturation, a constant RBC count, so that a constant energy is generated within the cells. And once this energy functioning is normal and a constancy is maintained, you will find that the amount of glucose, fats and proteins is maintained at a normal level. Hence you will find that, to give you the basic example, that the blood sugar levels. The normal fasting blood sugar levels, it is said, should be somewhere around 100. Post lunch it should be around 110 or 120, maximum 130 milligrams per 100 ml. So the body tries to maintain a constant glucose levels in the body. To give you the example, or to carry this discussion further from here, suppose you have taken an increased amount of carbohydrates, that is, you have taken more amount of sweets. So what is happening? As long as you take food immediately, or you take a food which has got a high content of glucose, there will be more absorption of glucose from the GI tract. The blood sugar level will go up from 110, 120 to 140, 150. Immediately the body will see that the internal environment is disturbed, the homeostasis is disturbed, and the body will try to see to it that the blood glucose level, which has shot up to around 180, 190 after eating a high carbohydrate content food, comes back to around 120. And how does that do? How does the body does that? It immediately sends signals to the beta cells of the pancreas, that is the islet cells of the pancreas, so excrete more amount of insulin. So there is an immediately increase in insulin secretion, and this insulin, when it is secreted in more than normal quantity, sees to it that the additional blood glucose which is there is entered back into the cell, and once it goes back into the cell, the blood glucose levels come back to normal. Now what is the alteration here? The pathophysiology here is, if there is a decreased insulin secretion by the beta cells of pancreas. So what happens? It results in a constant or a blood glucose level not coming back to normal after a high carbohydrate or a carbohydrate rich diet. This we call it as diabetes. To explain this a little bit further here, there can be two types of diabetes. One, where the insulin which is secreted by the beta cells of the pancreas is secreted normally in response to the high blood glucose, but it is not acting on the cells. It is not acting on the 75 trillion cells to cause the glucose to move from the ECF inside the cells. So insulin secretion may be normal, but action of insulin, the sensitivity of the cells is not there. So there is a high sensitivity of the body cells to insulin. Or there can be basically a less number of beta cells in the pancreas. When there is no beta cells or less number of beta cells, less insulin is produced. When less insulin is produced, there is no mechanism by which the glucose can enter into the cells, hence resulting in hyperglycemia, which we call it as diabetes. In biochemistry, they will tell you what is type 1 diabetes and type 2 diabetes. So basically here, these are the few examples of what constitutes homeostasis and how it is important that the constant internal environment be maintained. If there is a disturbance, you will find that there is a damage to the other organs. Say for example, if there is anemia, if the body doesn't correct this anemia, or the less RBC count is not restored back to normal. So what is the consequence? What is the pathophysiology involved, and what is the medicine involved here? So there is a constant less number of RBCs. Instead of 25 million RBCs, there are less number of RBCs, less oxygen carrying capacity, less oxygen supplied to the tissues. Let us say less oxygen supplied to which tissues? To the muscles, the nervous tissue, the cardiac tissue. So next, the organs are affected, the heart is affected. When the heart is affected, because oxygen is needed for the pumping action of the heart to beat normally. You know that the heart is nothing but the cardiac muscle. For the cardiac muscle to beat or to contract and to pump, it needs regular supply of nutrients. If these nutrients is not there, the pumping action will be reduced. Ultimately, the whole organ, the cardiovascular system will be disturbed, and because of the heart failure. So see the sequence of event. Homeostasis is not maintained, RBC carrying capacity reduced. When the RBC carrying capacity is reduced, decreased oxygen supplied to the cardiac muscle, the pumping ability of the heart is reduced, the heart pumping is reduced. When the heart pumping is reduced, the blood pressure falls and the system starts failing. So when it is not, the heart is not pumping effectively, less oxygen is going to the various tissues, and blood and the fluid starts accumulated, resulting in a chain reactions. Similarly, you see, if you go into a high altitude where there is dyspnea, where there is less oxygen supply, if you don't try to come back to normal, you will be breathless. When there is a breathlessness happening, there is an increased respiratory effort. When there is increased respiratory effort, increased energy is utilized in the body to maintain a normal functioning. And still, because there is less oxygen supply, there will be more energy utilization and less oxygen supply, resulting in easy fatigability of all the body systems there. Similarly, when you go into the pancreatic islet cells, there should be a normal glucose levels. If there is less insulin, though there is a high blood glucose levels, but the glucose is not entering into the cells because of the lack of insulin. So there is no carbohydrate entering into the cell. The intracellular functioning mechanisms are disturbed. That means the enzyme systems are functioned. Energy is not created. Energy is not generated, resulting in consequences where the kidneys are affected, the heart is affected, the neurons are affected. A chain reaction sets in. So this becomes pathological, and ultimately it becomes disease, and you have to treat for diabetes. Now we go on into the next section where we will discuss about the regulation and the integration of the various systems. Basically, if you see the body weight, the 60 to 70% of the body weight, say for example, if the average body weight is somewhere around 70 kgs, 70% of it, somewhere around 45 to 49 liters of it is water. This water is divided in the body into two compartments. One is the ECF and the other is the ICF. ECF means the extracellular fluid and ICF means the intracellular fluid. Now, so extracellular fluid is the fluid or the content of water which is present outside the body and is called as the extracellular fluid. ICF is the content of the cells or the water which is present within the cell and is called as the intracellular fluid. So basically there are two compartments within the body, the ICF and the ECF. Now each of these components of the body consist of water, and apart from water they constitute certain other substances, and these substances are nothing but the same nutrients, that is the carbohydrates, proteins, fats, Plus, in addition to water, they contain certain elements, micro elements like sodium, potassium, calcium, chloride, and bicarbonate. If you see the constituents of the ECF, you will find that in the ECF, apart from water, the most important constituents present there are the sodium. Sodium constitutes an important ion in the ECF. Whereas within the ICF, you will find that the most important constituent is the potassium ions. In addition to this, you will also find that within the cells, that is the ICF intracellular fluid, consists of a high content of proteins, high molecular weight proteins, and amino acids. Now, these high molecular weight proteins and amino acids, because of their size, do not move or remain confined into the ICF and do not move from inside to outside. There is also another important point which you should understand here, that though sodium is present more on the outside and potassium is present more in the inside, other ions are also present in the ECF and the ICF. It's not that if sodium is mostly present in the ECF, it is not present in the ICF. Or if potassium is present inside the ICF, it is not there in the ECF. The constituent or the levels of the sodium outside is more than that of inside, whereas the concentration of potassium is more in the ICF than in the ECF. Similarly, you have got negative ions, magnesium ions, iron ions, zinc ions, you have got the chloride ions and the bicarbonate ions. The other important factor here is that there is a constant movement of the sodium ions and the potassium ions and the chloride ions and the bicarbonate ions from the inside to the outside. So there is a constant exchange of these ions taking place. Whenever there is a need for them for proper functioning of the body, the sodium ions may go from outside to inside, or the potassium ions may move from inside to outside. But once the mechanism is over, the functioning is restored back to normal, the concentration also comes back to normal. So therefore it becomes important that to maintain a stable internal environment of the body, or to maintain a constant internal environment, restoration of these ions to the normal concentration should take place. So now let us briefly see how the nutrients are coming into the ECF and the ICF. As I said, the extracellular fluid is the fluid which is present outside the cells but within the body, and it is called as ECF. Now, one of the most important structure, one of the most important organ system which maintains a normal constant nutrient in the ECF and the ICF is the cardiovascular system. Here you can see that there are the lungs are shown, then there is a circulatory system, there are two pumps, the heart is there which is divided into right heart pump and the left heart pump, and there is a circulatory system. If you see here, the lungs provide the oxygen, the oxygenated blood goes into the heart, the left heart pumps it, drains the blood from the circulatory system into the various organs. Let us say here it is the GIT, there it is the kidneys, and then it is the capillaries. So through a channel of arteries, which are large arteries divided into small arteries, arterioles and capillaries, you see that the blood, oxygenated blood is going into the capillaries, and from the capillaries the fluid is drained into the cells, and ultimately from the capillaries the essential nutrients are drained into the cells, which may be the cells a part of an organ or a part of a tissue, and the waste products are in the reverse direction drained from the cellulars or from inside the cell into the capillaries. So at the venous end of the capillaries, the waste products are taken up, and through a network of veins, small veins and venules, it is sent back into the heart through the right heart pump. The right heart pump carries the deoxygenated blood and goes into the lungs, where the carbon dioxide is liberated out into the atmosphere, and again the oxygen is replaced by oxygen. So this whole cycle goes on and on, where the heart pumps at a rate of 72 times per minute. During each pumping action, you will find that carbon dioxide is liberated into the lungs, oxygen enters from the lungs into the systemic circulation. This systemic circulation carries the oxygenated blood into the tissues and the capillaries. The capillaries supply this oxygen and nutrients to the tissues. The tissues use up this oxygen and nutrients and generate certain waste products. The waste products enter into the body, into the circulatory system, and are drained out from the cells through the venous end of the capillaries to the venules, and from the veins they drain back into the inferior vena cava and the superior vena cava, reach the right atrium, right ventricle, and then back into the pulmonary artery. From there it drains into the lungs. So the oxygen is liberated out into the atmosphere, which again now is replaced by oxygen. So the most important supply of oxygen to the tissues is taking at the level of the capillaries. So the respiratory system, working in tandem with the cardiovascular system, sees to it that there is a constant supply of oxygen to the tissues. For this constant supply of oxygen to the tissues, two things are necessary: a normal functioning of the cardiovascular system, a normal functioning of the respiratory system, and then a normal count of the RBCs are essential, so that ultimately the oxygen which is entering into the body is carried by the RBCs and supplied into the lungs, and that transfer of gases takes place by the capillaries. And remember here that all the cells in the body, or all the tissues of the body, or all the organ system of the body are supplied by a rich network of capillaries. So wherever cells are there, you will find that these capillaries are present, and through these capillaries, the oxygen is supplied to the cells. Apart from that, the role of the cardiovascular system in supplying nutrients. Say for example, the GI tract plays the second important role in providing nutrients. We eat food, we eat different types of food. This food enters into the GI tract, it passes through the stomach, from the stomach duodenum, and from the duodenum it goes into the small intestine. Right from the oral cavity, then into the stomach, and then into the duodenum and the upper part of the small intestine, two processes are taking place. One, breaking down of these food particles into breaking down these complex food particles into simpler substances is taking place. Mostly this digestion part takes place in the stomach and in the upper part of the small intestine. Once this food is broken down into simpler substances like your amino acids, glucose and fatty acids, absorption takes place in the other half of the small intestine, where the simpler food substances are absorbed by the body, especially the GI tract, and enters into the circulatory system. And once it enters into the circulatory system, because of the pumping action of the heart, this is carried from these nutrients are carried from the GI tract through the systemic circulation to the various tissues. To explain the example here, say for example the carbohydrates, the glucose which you are taking in. You take a complex carbohydrate or a carbohydrate diet. In the stomach it is broken down into simpler sugars. These sugars are absorbed from the small intestine. From the small intestine they enter into the circulation. If you see the diagram, you will find that the blue arrow is there. So it enters into the venules through the venous end of the capillaries. It goes into the veins. From the veins it goes into the systemic circulation, and from the systemic circulation it goes down into the various tissues, and at the capillary level this glucose diffuses from the blood through the capillary membrane into the various 75 trillion cells in the body, so that energy is provided into this. Once this glucose enters into the cell, there it is taken up and broken down, or converted into glycogen, or it is stored, or it is broken down to give energy. ATP is generated. So this is how the other mechanism by which nutrients are supplied in the ECF, and from the ECF to the ICF is the GI tract. Then the other area which is plays an important role in maintaining normal homeostasis and helps in the normal functioning of the body and keeps the internal environment constant is the kidneys. The kidneys are the organs where all the waste materials are filtered and excreted out. The tissues utilizing this oxygen, or the cells utilizing the 75 trillion cells utilizing this oxygen, utilizing this glucose, fats and fatty acids and amino acids break down, and they release the waste products like urea, creatinine, uric acid into the systemic circulation. From the systemic circulation, it is carried on to the kidneys, and in the kidneys you have got the glomeruli. The glomeruli, it gets filtered, and after it is getting filtered to the kidneys, it is excreted out from the urinary tract. So basically, for a normal functioning of the body, it is essential that the waste products of the body should be eliminated, and this process of elimination is done by the kidneys. Imagine a situation where the kidneys are functioning less effectively or have stopped functioning. So what will happen? Once the kidney functioning is stopped, the filtration function is gone. When the filtration is not taking place, creatinine, urea, uric acid are not removed. When they are not removed, they accumulate in the blood, they accumulate in the body. The blood levels of urea and creatinine is raised. This results in a disturbance in the homeostasis. To explain it more simply, I will give you one simple example how kidneys are helpful in affecting in maintaining a normal environment. We know that there is an ECF constant, there is a ECF present. In the ECF, there is a constant amount of sodium, constant amount of potassium, and a constant water level is maintained. The total body water in the ECF is also to be maintained normal. Say for example, you have taken ingested some excess of water. Instead of normal 100 ml, 200 ml of water, you have taken 1 liter of water you have ingested. Now what happens? Once you drink this 1 liter of water, it goes into the GI tract. From the intestinal mucosa, it is absorbed. When it is absorbed, the blood volume is increased because there is extra 1 liter of water which has got absorbed. So the blood volume is increased. When the blood volume is increased, it causes a breakdown or a disturbance in the homeostasis. The internal environment is disturbed, where instead of 5 liters of blood volume, you will have additional 6 liters of blood volume. So the blood pressure will increase, but the body tries to maintain this normal, bring down the fluid level back to normal by excreting the extra amount of water you have ingested, and this is done by secreting more or forming more amount of urine by excretion more amount of urine. So through urine you will find that this extra water which you have congested is lost. So there is an increased diuresis. So within half an hour or 1 hour, you will find that there is increased frequency of urination or micturition, and the excess intake of water has been eliminated out from the body, restoring the blood volume back to normal, the water content back to normal, the blood pressure back to normal. The same principle involves if you don't take water. Say for example, if you are on a total fasting, and you have taken water from morning to evening, there will be less intake, there will be less water in the body because some amount of water is already lost through sweating. So the blood volume will come down, the body water will come down, there will be a dehydration, the blood pressure will fall down less than normal. So how does the body tries to maintain a constant environment, internal environment? It tries to maintain the normal body water by forming less amount of urine. So normally in the daytime, if you have a constant urine output of 1 to 1.5 liter, the body will try to form less amount of urine. When there is less amount of urine formed, that means that 1 liter of water is still present in the body. When that 1 liter of water is lost through urine, the blood volume remains normal. The other signal the body gives is it constantly stimulates your thirst center, and when a thirst center is stimulated, you try to drink water. So whenever there is a less intake of water, the thirst centers are stimulated, causing you to drink more water so that the blood volume is restored back to normal. So in this way you will find that the cardiovascular system, the GI tract, plays an important role in the origin of the nutrients, in supplying nutrients to the body. The kidneys plays an important role in maintaining a constant internal environment by excreting whatever is not necessary in body and also excreting whatever is in excess. And when it finds that there is a little less than the normal values, it reduces its function so that the loss does not happen and the values are restored back to normal. The other important system which helps in maintaining a constant internal environment is the musculoskeletal system. You may be wondering how musculoskeletal system helps in maintaining a constant internal environment. If you see the major part of the body, it is muscle and skeleton. The muscle and the bones are the major constituents of the body. By causing muscle movement, by causing the body to move it, and by maintaining a normal tone, it gives stability to the body, and it sees to it that the normal parameters, especially of the cardiovascular system, are maintained. Say for example, we will discuss this in the later subsequent classes, how the musculoskeletal system helps in maintaining a normal tone. Say for example, if you are standing for constant hours together, when you come back physically in the anatomy hall, you will be standing for 2 to 3 hours. When you are constantly standing there, you will find that there is a sudden vasovagal syncope happening, the blood pressure falls. At that time, to prevent you from falling or to correct your low blood pressure which has occurred because of you standing for a long time, the musculoskeletal system gets stimulated and forces you to sit down or to lie down so that your blood pressure comes back to normal. So this is one small example I am giving to you to understand how musculoskeletal system helps in the normal maintaining of blood pressure in abnormal conditions. Now, the other system is, here we have discussed till now the origin of the nutrients. Here this is another example where I was discussing about the capillaries. This is an example of capillaries where at the upper end you will find the arteriole, at the lower end is a venule. This is an example of a capillary. Here you will find that as the blood is moving from the arteriolar end towards the venous end, nutrients or substances which are important to the body are getting out from the circulatory system into the cells. Say for example, oxygen. Oxygen moves from, at the arteriolar end, moves from that capillary into the surrounding white area. The white area or the light brown, light red area is the tissues. So glucose, the oxygen, the sodium and the other contents will move from the capillaries into the tissues at the arterial end. By the time the blood reaches the venous end, you will find that the same tissues which have now taken up the glucose, sodium and oxygen will push back the urea, uric acid, creatinine and carbon dioxide into the circulatory system, so that through the veins it goes back towards the heart, where carbon dioxide through the lungs is liberated into the atmosphere, and the urea, uric acid which has got entered into the vein, into the bloodstream at the venular end, is removed at the kidneys. So basically, now we see that there is a constant internal environment maintained because of the cardiac system, the respiratory system, the GI tract and the renal system. But who is regulating all these structures? There are only two mechanisms by which the body which play an important role in regulation of the normal functioning, and one is the nervous control and the other is the endocrine control. So all the regulations of the body are under the control of these two systems, and one is the nervous regulation and the other is the endocrine regulation. Endocrine regulation means hormonal regulation. You may also wonder, why do we require two mechanisms whereas nervous and endocrine? There is one difference between the two. The nervous regulation is always a fast acting regulation. It acts immediately, and the action of the nervous regulation or the nervous system in the body is for a short duration only. So whenever the nervous regulation comes into play or it is stimulated to bring back to normal, you will find that the nerves are stimulating the body, the nervous system comes into the picture, it corrects the picture or it corrects the system for a very short, immediately, that is rapid onset of action, and for a short duration, and its action is over within a few minutes or few hours. Whereas when the endocrine system is regulating any functioning in the body, the action to start takes a little longer time. But once its action begins, it persists for a long period of time, and for its action to be completed or to be stopped also takes a long time. So this is basically the difference between the nervous regulation and the endocrine regulation. The nervous regulation is very rapid, it acts very fast and is very short, and it gets over within a short period of time. Whereas the endocrine regulation the endocrine regulation takes a long time to start. Its action persists for a longer period of time, and for the action to stop also takes a long time. Say for example, let us discuss about the cardiovascular system and the blood pressure. When the blood pressure normally should maintain 120 by 80, standard thing. Suppose you are suddenly getting up or changing posture. When you are suddenly changing posture, what is happening? Because of the gravitational pull, there is a sudden drop in the blood pressure. Now the body will immediately detect that there is a drop in the blood pressure, and the body will see to it that the blood pressure is restored back to normal. So this sudden drop in blood pressure has to be restored back immediately. Otherwise, if it is not corrected, or if the blood pressure remains low for a little longer period of time, suddenly you will get a blackout, blackening in front of the eyes, less supply of blood to the brain, less oxygen to the brain, and you may suddenly get a vasovagal attack because of the hypoxia to the brain, and you become unconscious. So how does the body restores it? At that time the nervous regulation comes into play, that is the baroreceptors come into the play. The baroreceptor mechanism detects that the body, the blood pressure is fallen down or has gone down. There is a hypotension in the body. The baroreceptor suddenly stimulates the heart, and when it stimulates the heart, suddenly the heart rate increases and the force of contraction increases, and the blood pressure is brought back to normal within a few seconds. So this rapid action is possible only by the nervous system, and this baroreceptor action may remain for few minutes to few seconds. But beyond that, it cannot control the blood pressure back, cannot regulate the blood pressure to normal if the stimulus is persisting beyond that. Whereas the endocrine portion, if the endocrine system comes into the play, if it detects that there is a blood pressure is less than normal, the endocrine system will stimulate the pituitary gland, it will stimulate the various hormones, it will stimulate the ADH hormone, and the ADH hormone will then act on the kidneys, cause reabsorption of water, and when it reabsorbs water, the blood volume will be restored back to normal. So, in the restoration of blood pressure, there are two components acting. One, the nervous component, which immediately sees to it that the blood pressure is brought back to normal, whereas the endocrine component will act over a few minutes or take few minutes to start acting, but the action will be persisting there for hours together. How will the endocrine system help? The pituitary gland will secrete antidiuretic hormone. The antidiuretic hormone will act on the kidneys. It will cause increased reabsorption of water, decreased urine formation, so that whatever water is in the body is restored and is not lost as urine, so that the blood pressure remains constant. So one is the short-term regulation, the other takes part in a long-term regulation. So both these together, working in tandem with each other, sees to that a constant internal environment is maintained. Now let us see what are the other mechanisms which are helping in maintaining a normal or constant environment. The other is the immune system of the body. The immune system of the body and the integument of the body also sees to it that a constant homeostasis is maintained. What is immune system? The immune system is nothing but the ability of the body to fight back infections. So whenever there is an attack by a virus or there is attack by a bacteria, the WBC cells are stimulated. In the WBC, you have got different types of cells, the neutrophils, the lymphocytes, and you have got the antibody response. So all these responses will get stimulated whenever there is a disturbance in the homeostasis, and this disturbance of the homeostasis can occur by invasion by a virus or a bacteria into the body from outside. So first the immune system sees to it that it wards off or it eliminates the foreign invaders and sees to it that the body function remains normal, it does not get disturbed. The other natural immune system, the other natural fighting capacity which has been bestowed on the body is by means of the integumentary system, that is the skin. The skin is the best protector of the internal organs from any foreign invasion. Imagine if there is no skin. The viruses, the bacteria which are present in the atmosphere would have directly invaded into the body or would have invaded the tissues. So the skin acts as a barrier, and this barrier prevents a direct attack of the prevents a foreign invasion directly into the internal system. So indirectly, in an indirect method, the immune system of the body and the integumentary system of the body, that is the skin and its functions, helps in maintaining a constant internal environment. Now there are two concepts in this regulation which I would like to tell. One is the negative feedback mechanism and the other is the positive feedback mechanism. Now what is negative feedback mechanism? At this point of time, just in the beginning of the session, you need to understand only one thing. Negative feedback mechanism means that a parameter or a system is trying to disturb, the body is acting by preventing that disturbance, by negating that effect, hence it is called as a negative feedback mechanism. The other is the positive feedback mechanism. A positive feedback mechanism is a mechanism that indirectly enhances the stimulus to act more and more in one direction. Basically, negative feedback mechanisms are protective. Positive feedback mechanism leads to instability and to a disease. But there are certain examples where the positive feedback mechanism have also been helpful to the body. This point of time, I think I am finishing my session. We will continue this in the next class whenever I come back. Meanwhile, I would like to just highlight two things. From today, there is a change in the timetable. The second session will be for anatomy from 11 a.m. to 12 a.m. and 12 p.m. I mean, and from Monday to Friday, after this 11 o'clock, you will have the anatomy session. So 10 to 11 every day from Monday to Friday will be either biochemistry or physiology. From 11 to 12, you will have an anatomy class. The other thing which I wanted to tell you was about the books which you need to read. This is one book. Actually, the basic reference book should be Textbook of Medical Physiology by Guyton and Hall. That should be the main book to understand the concepts of physiology. In addition to this, there are two other books which you can take as a reference books. One is the Textbook of Medical Physiology by Volume 1 and Volume 2 by this is G.K. Pal, and another book which we have been recommending is a Textbook of Physiology by Dr. Venkatesh. In all these books you will also find an online version, and this online version helps you in both the books. Either you buy Textbook of Physiology by Dr. Venkatesh or Textbook of Physiology by Pal or Guyton. There is an online version also helpful where it makes the understanding of the subject very easy. So please purchase any one of the book and follow it thoroughly. And the other thing is, we have also given in the timetable the teaching schedule for the 1 month. Normally it is a practice that we release the teaching schedule, and when you come for the class, you just read about that particular topic which is being taken, so that you are well prepared and we can have certain discussions. So the understanding of the subject becomes easy, and we can go a little bit depth into the subject, and we can discuss the clinical aspects related to that particular topic. The only precondition is that you have to give one reading, try to understand that particular topic beforehand. Thank you. All of you have a nice day.